I'm an analytical chemist, and I want to talk about how to measure those different exposures and how to overcome this garbage in, garbage out problem, which we often have, I would say, in this high resolution mass spec field. So we really want to get high quality exposure data, and we want to get it simultaneously. The mission of my team is to develop new mass spectrometric methods for capturing parts of the exposome, and using mass spectrometry, of course, we cannot measure everything, but we can cover many of the most important categories or classes of exposures coming from bioactive molecules in food, environmental toxicants, contaminants, drugs, biotransformation products thereof on one hand, but then also all these endogenous internal exposures related to hormones, endogenous metabolism, the metabolome, and microbial metabolites. So when we using mass spectrometry to measure the exposome, we have two principal approaches that we can use. On one hand, we have the targeted methods where we sharp as a laser. Oh, it's not working, but anyhow. And where we have reference standards and really get very high quality data. We have reference standards, we have quantitative data, we can use standard reference material from NIST or other resources, but we are very limited in the chemical space that we are covering. So typically, state of the art is to measure maybe a couple of dozens of exposures at a time. When we are looking at the non-targeted, this is good from the perspective that we have a very broad picture and we can cover multiple things that we also don't know. So we can also look for known unknowns and unknowns, but typically we are not as sensitive as in the targeted assays. So within the next 30-40 minutes or so, I will present to you two workflows that my lab developed, one in the targeted and one in the non-targeted area. We also have stable isotope measures for looking specifically at biotransformation processes in cell cultures, in vivo models and so on, but I will not talk about that today. But getting started with the targeted analysis. So this is based on what was traditionally called human biomonitoring, so looking at exposures of special interest in human blood, urine, breast milk, saliva, hair, teeth, whatever. And what we wanted to do here is for the first time have one method where we can simultaneously fast, quantitative, selective measure as many of those toxicants as possible. So we came up with finally covering more than 81. Sorry, I'm always touching the wrong button. Should be that one. More than 80 compounds that we can measure partially in the picogram per ml range, which is highly sensitive. And we could cover and validate this method for different, quite complex analytical matrices, including also breast milk. And what's important is that we did not look at specific classes. So during the last month, for example, the bisphenols were very much in the media because the EFSA established a new tolerable daily intake, and now all of us are clearly above that and are at risk, and there are many nice targeted assays for that, but we cover also all these natural contaminants, personal care products, perfluorinated substances, and so on. And just to show you that this works, I want to show you the data from some samples from a pilot study that we did with the Medical University of Vienna from the Visceril lab. Here we got plasma samples from extremely premature infants, partially birth weight just above half a kilogram, so extremely poor babies and parents. And you can imagine that many of them have a lot of health issues later in life. So we wanted to find out, on one hand, what's the importance of the microbiome, which I will not talk about today, but we also want to find out what's the contribution of exposures in the development of this disease from babies that are connected to IV tubing for the first month of life and are in incubators. So we got tiny amounts of the plasma, partially as little as 50 microliters, which is an additional analytical challenge, and I think very important in exposome research, because if you want to do multiple measurements, you can imagine you cannot draw a lot of blood from these babies. So the quantity of the biofluid is really limiting. And then we followed up with our very generic sample preparation method, analyzed everything on a Q-trap triple quadrupole instrument, and what we found was not unexpected, but it's still kind of shocking, I think, to see that we can find so many chemicals partially at quite high concentrations, and I think this nicely demonstrates why we need this exposome view and look at different stuff. So we could find natural contaminants that have been around for thousands of years. We found many synthetic plasticizers, as expected, of course, consumer care products, industrial chemicals, and so on. If there are chemists among you, here are some chromatograms, so we could also achieve nice chromatographic separation. We even did MS2 spectral matching because we couldn't believe some of the xenobiotics because they were not found even in tailored assays before, but we could confirm all of them. So this is really high quality data. And to look at it quantitatively, you see that this is another challenge in exposome research, that we have to cover some chemicals that are very high abundant and others are extremely low abundance in the sub ppb and ppt range. And here we could cover already 6 orders of magnitude, and we are further working on that to get even more sensitive and having coverage of an even broader concentration range in the future. This data was published. We also did a longitudinal study in breast milk, which I cannot talk about right now, but it's also covered in a paper in case you are interested, where we followed up the contamination pattern of a baby by measuring breast milk samples over the first 200 days of life. That was targeted stuff. So personally, I would not really regard it as exposome because it's not non-targeted. It's still beyond state of the art, but I think the real future will be the non-targeted analysis, where we're going to high resolution measurements and can also look for emerging contaminants that we maybe don't even know today. So here I want to present you one workflow that was developed by Mira Flash over the last 4 years. So it was quite an intense PhD work. And this is a completely novel concept that was never used in this field, where we want to have high throughput. Our ultimate goal is to make technology available where we can measure thousands and maybe someday tens of thousands of blood, urine samples, whatever, and get high quality data. So we need to have faster turnover times. The standard workflows when using metabolomics are like half an hour for one chromatographic run maybe. Then typically you do one reversed phase run, one helic to have different coverage of metabolites, one in electrospray negative, one positive, so it sums up to 2-3 hours per sample. And you can imagine if you do that on 1,000 samples, you need another 1,000 samples for quality control. You need a couple of years to do that, and it's basically not impossible, but it's a real challenge. So we wanted to make this faster and go into the high throughput direction. So what we did is to use very fast gradients, only 15 minutes, and then have 2 columns work in parallel. So we're injecting the sample once on a helic, on a hydrophilic interaction liquid chromatography column, and on the other hand on this reversed phase that's covering more the lipophilic molecules. And then after the separation, we combine the effluents here in this T piece and go together into the mass spectrometer. By this we can reduce the runtime by 50%. And then in addition, because we're using here the Orbitrap technology, we can do fast polarity switching for positive negative mode and do these runs that would have been four runs in the past in only 15 minutes. And this was developed together with Gunter Körnsberger at our university. And an important part of that idea is that we want to get beyond just measuring exposures and also look directly at the effect of the biological effect. And a very good way of doing that is to look at the endogenous metabolome, and that's why we also need this increased coverage. The game changer, so as said, it took us some years to optimize that system because it's very critical to maintain sensitivity when you are diluting your sample, when you are putting different elements together. So one of the game changers here was to use ammonium fluoride in the aqueous phase for the reversed phase chromatography, and by that we could really boost sensitivity for many compounds, especially for endocrine disrupting chemicals, by up to a factor of 100 to 1000. And then we tested this method. I said it's very important for us to have high quality data, so we used more than 200 molecules where we had reference standards, over 100 endogenous metabolites, the metabolome to cover the biological pathways, and then also more than 100 xenobiotics. And here we used endocrine disruptors, we used food contaminants like these mycotoxins, plasticizers, and so on. So really a crude mixture covering all kind of different chemistries. And we evaluated then the typical analytical figures of merit in solvent standards, but also in spiked urine, because that's ultimately, of course, what we are measuring in our samples then. And what we found was quite encouraging. For the xenobiotics, so for the exposure part, we had an a median detection limit of slightly below 1 nanogram per ml, so below 1 ppb. And going 10 years back, I think everyone would have been happy to have these LODs using targeted methodology. So we are going into the right direction, but we are still not 100% happy because, of course, we also want to cover even lower chronic low-dose exposures, because for disease development, in many cases, they will be even more relevant than those high-level, not-so-toxic exposures, I would say. When looking at the effect side of things, the endogenous metabolites, the picture was even better. Here we could see that basically all of the endogenous metabolites had detection limits below 1 micromolar, so it means that we can measure physiologically relevant concentrations, and that we, using this method, we would easily see changes in the metabolome, next to having the direct measurement of all the xenobiotics. And here I just want to show you one example from a couple of Nigerian urine samples that we measured in collaboration with Chibunde Ezekiel from Babcock University, and we could see that it's really feasible to use this methodology to measure, on one hand, endogenous hormones, but also many different xenobiotics, going from plant hormones to plasticizers, personal care products. We found some toxins, like plant toxins here, the jacobin and ritalin, that have been hardly found in any biosamples so far. You would also not expect them in our diet very frequently, unless you're drinking a lot of herbal tea, but otherwise, we should be protected from them over here. But I think this nicely shows, okay, even if the method is not perfectly sensitive right now, it already works very well, and establishing it during the next couple of years, I think we are really getting where we want to go. And this was just published a couple of weeks ago as a preprint, so the final paper is not out, but here you can see the full evaluation of the data in case you're interested. Coming back to the question of my title, so can we measure the chemical exposome? Is it feasible? What do you think? Could I convince you? We heard from the previous speaker that it's not a problem to measure exposures. I agree, we can measure them, but it's a real challenge to get high quality data to be highly sensitive and reproducible. And to do this on thousands of samples in exposome-wide association studies, I think we are not quite there, but we are on a very good way. And I think with all these networks, EHAN, ARENA, and so on, in a couple of years, we should be there. From the concept of exposomics, I hope that I could convince you that high resolution is not the ultimate solution right now. We still need to match them up with targeted methods to get more sensitive data and have the quality control we need. And just to show you, this is from one of our newer publications on how such a high-resolution workflow looks like. I mainly covered here this yellow part of the sample treatment and separation and so on, but all this data processing and so on is really a huge challenge where a lot of investment is needed and where we all need to work together. And I think, and that's probably my main conclusion why this whole exposome field is so important, is that we need to really overcome the scientific silos and work together. Medicine, analytical chemists, environmental researchers, toxicologists, and so on. And I think here these new initiatives like EHAN, it's not that new anymore, but IRENE is new. We will hear much more about it in the next presentation, which I'm very much looking forward to, are the way to go to really work together and make this happen. With that, I would like to thank very much again the organizers for inviting me, all the funding agencies, collaborators, and most of all my former and current team members. And thank you very much for your kind attention.